Good afternoon, everyone. I am Paige Bell with DeKalb County Human Services, and I want to say welcome to all of our Lunch and Learn series. We are excited to bring to you today Miss Cashmere Miller. She will be our dynamic speaker for today, but before the introduction, please remember to put your questions in the Q&A, being that the webinar chat is disabled. Cashmere Miller is a doctor of nursing practice, advanced practice registered nurse, certified family nurse practitioner, and is a family nurse practitioner with over a decade of experience and a doctor of nursing practice from Mercer University. Currently a lieutenant commander in the U.S. Public Health Service, she serves in the Department of Veterans Affairs as a clinician with Vet Home, specializing in military environmental exposures. She is a recipient of the USPHS Service Medal. Dr. Miller authored Military Environmental Exposures in the American Journal of Nursing and is dedicated to whole person healthcare for underserved populations. She is also the founder and executive director of Community Whole Health, which provides quality healthcare access to medically underserved adults. She is now happily married to her husband of 18 years, and they share 4 happy children. I would like to present to you today Ms. Cashmere Miller.
Hello, everybody. Good afternoon. Thank you for having me on this webinar. So today we're going to be discussing 6 pillars of wellness, evidence-based strategies for optimal health. And yes, thank you for that introduction. I am the founder and executive director of Community Whole Health, and our mission is to provide access to education and support to medically underserved adults. And so we're a nonprofit organization, and we're focusing on health disparities through lifestyle medicine changes. And we want to, what we do is provide care for people who are uninsured or underinsured and help them address chronic conditions and empower them to manage their lives more effectively. And so we provide, as I mentioned, health education workshops, and we are going to be opening up our new clinic this August. We'll talk more about that at the end. So for today, what we'll do is go through a couple of things so that we talk about lifestyle medicine and really talk about the 6 pillars so that you all can have some key points to take home. And so we'll define lifestyle medicine and talk about why it's so important right now in this time. And then I will provide you with some evidence-based approaches to lifestyle medicine and give you some tips about how to manage some of these lifestyle related conditions. And so lifestyle medicine is a medical approach. It is actually, there's a College of Lifestyle Medicine, and it focuses on preventing and treating and reversing chronic diseases through lifestyle modifications and addressing root causes, rather than just relying on medication or surgery, what I like to call sick care. It's shifting away from sick care to well care, and it's built on 6 pillars. The first being nutrition, emphasizing a plant-based eating pattern. The next is physical activity, incorporating regular exercise, sleep, trying to make sure you get restorative sleep, and stress management, and also avoiding harmful substances like limiting tobacco, excessive alcohol, or other toxic substances. And also social connections, I forgot that one. So that's just fostering meaningful connections and relationships. That's going to help, you know, your psychological support, but the ultimate goal for all of this is to treat, prevent, or even reverse chronic disease. And so again, these are the 6 pillars here, and we're going to talk through each of them. So here on the screen, I've listed some lifestyle related risk behaviors, and these contribute to diseases by causing inflammation, oxidative stress, and organ damage in different ways. And ultimately, again, it causes disease, whether it's heart disease, cancer, diabetes. These poor risk behaviors, having a bad diet, being a smoker, not getting enough sleep at night. And if you're an adult, you need around 6 to 7 hours at least. Drinking excessive alcohol or other substances, could be you know, drugs or anything that you're using excessively, and tobacco use and secondhand smoke. All of these things are driving what a lot of our top chronic conditions that we're suffering with in this country. And so this information here on the slide is from the Global Risks Report in 2010, and it's really looking at chronic diseases as a growing global threat that it is. And it's attributing the rise of these lifestyle factors like poor diet, lack of exercise, and ongoing aging of our population, and emphasizing how it's impacting our health. So as you can see, there's 8 risky behaviors here. And these are all the behaviors I mentioned in the previous slide that are driving the top 15 chronic conditions that we're suffering with. But these are also responsible for 80% of the total costs worldwide. So these 8 lifestyle behaviors were demonstrated in this report to drive the top 15 conditions that are consuming the healthcare costs worldwide. And so we're spending a lot of money because people are constantly coming down with these top diseases here: diabetes, chronic, heart disease, hypertension, um, obesity, cancer, asthma, arthritis, all these things. And they're all driven by these top 8 risky behaviors: the smoking, the stress, insufficient sleep, lack of getting your health screenings, not getting enough physical activity, poor diet, drinking too much alcohol, and just having a poor standard of care in general. And so we have an enormous chronic disease epidemic in the United States. Right now, it's been getting worse over the years. And it's sad because, we have money in this country. We have advances. We have technology. We have the information. We have the the knowledge and the expertise. But yet, we are a sick country, and so there's an increasing prevalence of obesity and diabetes. 6 in 10 out of 10 Americans have a chronic disease. 38 or more percent will be diagnosed with cancer during their lifetime. Almost half of Americans have a heart disease of some sort. 1 in 3 have prediabetes. That's 88 million people, and 34 million people have been diagnosed with type 2. And so patients with diabetes can expect to pay 3 or 2, almost 3 times higher in medical costs in general than the general population. But they're spending so much more money if they're diagnosed with diabetes. So these things are killing us. And a lot of it goes back to how we're living our life, simple things that we're doing and changes that we really should be making. And so this is a table. It comes from a study, a systematic analysis that studied health outcomes in the United States and provided a comprehensive assessment of patterns by health in each state. And as you can see, suboptimal dietary risk, is the #1 preventable risk factor for dying of a chronic disease. And there is a decline in life expectancy in US citizens. So if you're looking here at the top, the study revealed that the top 7 out of 10 are lifestyle related. And then it went on to conclude that, we're declining. Our life expectancy rate is declining in the United States. And so Mayo Clinic researchers looked at some data of about 4,700 people who participated in the National Health and Nutrition Examination Survey. And they found that less than 3% of Americans live a healthy lifestyle. And they defined it by these qualifications: whether they got 150 minutes or more of exercise in a week that was moderate to vigorous, a diet score and up to 40% of the healthy eating index, body fat percentage under 20% for men, or under 30% for women, or not smoking. And they found that, again, less than 3% of Americans are living healthy based on this criteria. So to talk about the life expectancy in the United States, this trend is really posing some concerns to public health. As you can see, in 2021, there was an evaluation done, and they saw that the U.S. Life expectancy at birth dropped to 76 years, 76.1 years, and that had decreased about 2.5 years since 2019. And the contributing factors is the interesting thing. Things that contributed to this decrease in life expectancy were: 1, an increase in overdose deaths. We know that that has been an issue with the opioid epidemic. And then chronic conditions and health inequities was another one. So the prevalence of chronic diseases, like I mentioned, heart disease, diabetes, cancer, these continue to affect life expectancy in the United States. And lifestyle factors such as obesity and sedentary behavior are contributing to this trend. So the fact that we're unhealthy, we're not eating right, we're not doing right, this is causing us to now have a decreased life expectancy as a whole. And then the implications for public health. The decline in life expectancy raises these urgent questions about access to care. Do people have enough doctors? Are the healthcare systems doing what they're supposed to do? And now we're questioning these things, and even the social determinants of health. Do you have a grocery store where you can access fresh produce in your area? Is it close enough? Do you have to take a bus? We're thinking about all these things now because of this new data. And so first we'll do an overview of nutrition because there's hundreds and thousands actually of studies that support the use of whole food plant-based diets and to help prevent and reverse chronic disease. So that's eating mostly whole unprocessed plant foods like fruits, vegetables, whole grains, nuts. These can help in preventing diseases like diabetes and providing essential nutrients to minimize harmful substances because they're not processed. And so diets that are emphasized that are in line with this type of thing is the Mediterranean diet that you may have heard of, the DASH diet. There's one called the flexitarian, and even certain vegetarian diets because they're fiber filled, they have antioxidant rich foods that they're recommended, and they decrease or eliminate your exposure to dietary toxins. So we need foods that are nutrient dense. But unfortunately, as a whole in America, we're just not eating it. Looking at these two plates, you'll see what Americans tend to eat. We tend to eat food that has lots of added sugar, high fructose corn syrup, saturated fats, processed grains, cholesterol, and it increases our risk for disease, obesity, type 2 diabetes, heart disease, and cancer. Again, poor nutrition is the leading cause of death globally. So if you look at this plate, this is what Americans typically eat on a regular basis. It's not that we're doing this in moderation. We're doing this too many times per week. And if just think to yourself, some people are pretty well disciplined. They cook their own food, but as a whole, in this country, we're not doing so well. So looking on the right side, the whole food plant-based eating plan, this is recommended by the American College of Lifestyle Medicine, and they draw this from the studies and the data that show that plant-based eating is better. Even Canada has a better meal plan recommendations than our country does. So looking at their plate, they're saying it should be half fruits and vegetables. And when you see the protein part, it's not a piece of meat. Not that meat should be excluded. It's just they're recommending nuts and grains for your protein and legumes, beans. And then for your carbohydrate part, you'll see different whole grain products, wild rice. There's all kinds of healthy things, quinoa that's recommended where you can get the good carbs, I would say. And those type of things tend to decrease the risk of obesity and diabetes and heart disease. And it could even reverse and treat the diseases that we have now. And because we're not getting enough of the micronutrients like magnesium, which could help with sleep, vitamin A, vitamin C. We're missing these things because we're always rushing and eating packaged and processed things. And over time, that's just creating an environment where it's going to be more conducive for disease in our body. And so I'm not going to be able to point out every macronutrient and micronutrient and that's healthy because of the sake of time. I'm just going to talk about certain ones that are a real big problem in the United States, and then I'll move on to other pillars. But fiber is so important because 95% or more of Americans are just not getting enough fiber in their diet. And it's found in plant-based foods. They're not in animal-based foods. So the standard American diet is about 12 to 18 grams per day, unless you're more disciplined than that. And so we need, if you're a man, you need more than 38 grams per day. If you're a woman, you need more than 25 grams per day. And it helps in various ways. For example, with heart disease, fiber can help with heart disease by reducing cholesterol. With weight management, fiber slows the speed at which food is processed in the stomach to the rest of your digestive system, making you feel fuller longer. For diabetes, fiber is good because it helps to slow the rate at which food is breaking down, and it reduces the blood sugar levels after meals. And then again, if you're having digestive issues, it increases the bulk that you need in your intestinal tract to help improve how many times you're having bowel movements. You should be having bowel movements on a regular basis, once a day at least. And there's many people who are just constipated, and they don't, it's not publicly known. You're not going to walk around saying that, but a lot of people are constipated, and it's a problem. It's causing things to happen in your body which are creating an environment for disease. And the other thing I want to point out specifically is sugar, because we're just addicted to sugar, I believe, in this country. And it again is a leading cause for other addictions, and it's actually similar to a drug addiction because of the dopamine and how it's transmitted in our brains. It causes us to want more. And so the CDC says that 3 in 5 Americans aged 2 and older exceed the recommendation to consume less than 10% of their total daily calories. And by the way, I put in the bottom in red, I'm not going to dwell on this, but children under 2 should not be having any added sugar in their diet, period. So the cookies, the cakes, when they're under 2 years old, it shouldn't even be a question. So I just wanted to put that in as a side note. So if you look at a can of soda, which is about 12 ounces, it contains about 10 teaspoons of added sugar. Well, if you drink that, you have already exceeded the amount of added sugar you should have for the day. So imagine drinking 2, 3 cans of soda, or even sports drinks, or coffee with sugar, creamers, and all that. You're exceeding what you should be in terms of added sugar. And so the main sources that we're getting it from, according to CDC, is a lot of it's coming from sugary drinks, as I mentioned, the soft drinks, fruit drinks, sports drinks, energy drinks, 24%. 11% of it is coming from coffee and tea. 19% is coming from desserts and sweet snacks, 9% from candy and sugars, and 7 from breakfast cereals and bars. So I would really caution you against certain cereals, especially Kellogg's brand, not just because of the added sugar, but because of the added chemicals and other things that are put in it. It is not good for us. Women should have less than 6 teaspoons a day, and men should have 9 teaspoons per day, not to exceed that, according to the American Heart Association. And again, because this is a health hazard, it's an issue. It doesn't have anything in it worth that we need. We don't have minerals or protein or fiber. We're not getting any of that from sugar. It causes wrinkles to be added to your face. It is associated with greater amounts of acne. It can, contribute to diabetes, of course. You're at higher risk for cancer of the breast and colon, and we'll go into that a little bit more later. They make you feel more hungry because it's disrupting your hormone levels, and it blocks leptin and increases insulin. Leptin is the thing that's telling you I'm full, but it blocks it, so you keep eating. It causes belly fat. It can ruin your teeth, and it's just downright addictive. So looking at some of the studies, this is one on diabetes and how a plant-based diet is helpful. And so in this study, as I mentioned, 96 million people have prediabetes and 38 million have diabetes. And it's developing in people younger and younger. So looking at this study, it was 9 studies they looked at, because this is a systematic review. And so this study showed that greater adherence to a plant-based dietary pattern, especially when they ate plant-based foods, was associated with lower risk of type 2 diabetes. And it concluded that a plant-based diet can significantly lower the risk of type 2 diabetes, for those who adhered to the diet, and it showed better blood control and decreased diabetes incidence compared to ones who didn't do it. So the bottom line for this study was eating plant-based foods actually helps you with diabetes, and that is partly because of the fiber. So emphasizing fiber, increase whole grains, nuts, and legumes, fruits, and not starchy non-starchy vegetables, diversifying your protein. And by the way, starchy vegetables is like corn, yams, and potatoes. So non-starchy vegetables have less carbs in it. And we don't have time to go into all that, but just you can look that part up. So diversifying your protein intake, not just getting it from one source, limiting your added sugars and limiting your processed and animal-based foods. Looking at heart disease, when it comes to nutrition, we know that this occurs when the arteries become narrowed and hardened due to buildup of fats in the artery wall. And so cardiovascular disease is the leading cause of death in the United States and globally. And 17.9 million people died from various cardiovascular diseases in 2019. And so these can actually be prevented by addressing behavioral risks like smoking, not eating right, obesity, physical inactivity, and the harmful use of alcohol. So it's what we're doing in our day-to-day life. So this is a study, what we call a landmark study. It's the Lionheart study looking at how a Mediterranean diet affects heart health, and it found that it greatly lowers the risk of heart problems for people who already had heart disease. And so patients who followed this diet reduced their chances of heart-related issues by 70% compared to those who ate a standard Western diet. And it showed that eating more fruits and vegetables, whole grains, and healthy fats was beneficial to heart health. And so this just tells you, it shows you like you can have the disease and still improve if you just change your diet, change what you're eating. And the like I mentioned before, it's not that you have to eliminate meat, it's just choosing what meat you're going to eat and how often you're going to eat it. So restaurant foods, packaged foods, processed foods really should be limited. That includes like bacon and sausage. You have to be very careful about eating things like that on a regular basis. But you can drastically change your diet and improve your chronic conditions. So quickly looking at obesity and cancer, we know that cancer results from uncontrolled growth and division of the cells. And when they're abnormal, they usually die off. But cancer starts when something goes wrong in that process, and your cells end up making new cells. And the old or abnormal ones do not die off as they should. So it grows out of control. But this there were several studies done, and this is information here is according to CDC. Being overweight or having obesity are linked to higher risk of getting 13 different types of cancers that you see here on the screen. These cancers make up 40% of all cancers diagnosed in the United States each year. And so breast cancer after menopause is the most common obesity-associated cancer among women, and colorectal cancer is the most common obesity-associated cancer among men. And so I think this is worth really paying attention to, given that, we're seeing higher and higher cases, the number of cases every year with cancer. Unfortunately, it touches everybody, and it may have even, impacted you individually, but this is something that we can get a hold of because lifestyle habits do play a part. And so this information here is what the National Cancer Institute scientists have studied these different additives, nutrients, and other dietary components to see if they had associations with cancer risk. So on the left side, where you see the red, these are the additives or other components that contribute to increasing cancer. So acrylamide is a chemical found in tobacco smoke and some food. And so it can actually be produced in certain vegetables like potatoes if they're overheated at high temperatures for a long time. And so studies in animal models have found that acrylamide exposure increases the risk of several types of cancer. Alcohol, even though many people have talked about red wine over the year for reducing cancer risk, there's actually no scientific evidence to prove that. So alcohol is actually a known cause of cancer. Heavy or regular consumption does increase the risk of developing cancers of the oral cavity, the pharynx, the larynx, esophagus, liver, breast, colon, and rectum. And that's based on science. Charred meat. So when you're grilling outside, there's certain chemicals that are formed when muscle meat like beef, pork, fish, poultry is cooked using high temperature methods. And so exposure to these high levels of chemicals can cause cancer in animals. What you should do to kind of combat that is to marinate your meat. That has been found to reduce that significantly. So marinating your meat well before you grill it on a charcoal grill. And so on the right side, we'll see some things that improve and decrease the risk. So cruciferous vegetables, so chemicals known as glucosinolates, which break down into several compounds that are being studied for possible anti-cancer effects. Some of these compounds have been shown to have anti-cancer effects in cells and animals. So eating your broccoli, those dark leafy greens of all kinds. I'm pretty sure you have a favorite cruciferous vegetable. They're good for you and they can help decrease your risk of cancer, and partly due to the properties it has in neutralizing free radicals. Vitamin D. Vitamin D is actually a hormone, and it's something that we're not getting enough of, especially people of darker skin color. It helps our body to absorb calcium and phosphorus and to make strong bones and teeth. And there have been observational studies that provided evidence that people with higher blood levels of vitamin D have a lower risk of colorectal cancer and overall cancer mortality. And it's not just cancer that it helps with it. Vitamin D can help boost your immune system. There are so many benefits to having vitamin D, and yet many people are deficient of it, especially people of color. And so getting a vitamin D supplement is imperative, especially if you're not going to spend enough time in the sun. And even if you do, a lot of times we're not spending enough time in the sun for that to really absorb. So a supplement is important. Antioxidants, again, they neutralize free radicals that can cause damage to the cells. And so research has shown that exogenous antioxidants can help prevent free radical damage associated with the development of cancer. So exogenous, things that you're eating. And there's lots of food packed with antioxidants, blueberries, especially strawberries, raspberries. They're rich in vitamin C, vitamin E, but again, those antioxidants on the smaller level are very important. Dark leafy greens contain them. Even dark chocolate has antioxidants in it. Carrots, tomatoes, green tea, artichoke. You want to make sure you're eating a diet rich of antioxidants. Okay, so overall, to wrap up the nutrition part, eating healthy is important to prevent or reverse chronic disease. So this was another systematic review and a meta-analysis that found that higher fruit and vegetable intake is associated with reduced risk of cardiovascular disease, total cancer, and all-cause mortality. So we've got to be eating foods that are high in antioxidants and phytonutrients, fiber, drinking water, nuts and seeds, fruits and vegetables, legumes, and whole grains, and as low as possible in the other side, saturated fats, trans fats, cholesterol, sodium, ultra-processed foods, and red and processed meats. Okay, moving on to physical activity. This is another pillar of lifestyle medicine that is significantly enhancing the lifespan of quality of life. And it does help actually reduce chronic disease and promote overall health. And it does this in several ways. So There are studies to show that getting moderate to intense vigorous activity at least 2 times a week is important. But part of the reason why it's important is because it works again on the cellular level. Actually, when you do moderate intensity or vigorous activities, it helps to lengthen your telomeres, which work again at the cellular level to help lengthen your life. And so usually as you get older, they cap off, they get shorter and shorter, and that's associated with aging. But if you exercise more, you can actually lengthen them. So this study here is looking at data from 2 large groups of adults over 30 years old to see how long-term moderate and vigorous physical activity affects the risk of dying from different causes. And so it found that around 150 to 300 minutes of vigorous exercise or 300 to 600 minutes of moderate exercise per week is linked to lower risk of death. While doing more than that, it doesn't, the study didn't prove that it will reduce the risk any further. So just sticking between the 100 to 300 minutes of moderate and then the 300 to 600, 150 minutes to 300 minutes of vigorous or 300 to 600 minutes of moderate. And that's just like 20 to 40 minutes a day if you're doing vigorous, or the 300 to 600 is 42 to 85 minutes a day of the moderate physical activity. And so I'll give you some examples of that in the next slide. But this study was a recent study that came out in 2022. And again, this showed that it decreased cardiovascular disease. That was one that was consistently observed. So it's, how do you get active? Just get out there and do it. You can get active at work, you can do it on your break. You can walk, you can run, which would be more vigorous, jump ropes, as many different things you can do. If you're injured, some people have bad knees, you can go swimming. There's multiple things you can do to get out and get active, but it's important. There's some immediate benefits: improve cognition, reduce anxiety, depression, improving your sleep quality. And then there's long-term benefits where you'll have weight management, reduce health risk. It strengthens your bones and muscles, especially as we're aging. It again manages chronic conditions, and it increases your chances to live a longer life. And so we'll move on to sleep management, because this is also another basic human need, just like eating or drinking and breathing. So according to the NIH, it showed that about 50 to 70 million Americans have sleep disorders, and 1 in 3 adults do not regularly get the recommended amount of uninterrupted sleep that they need. And this is important because when we sleep, so much is happening in our sleep. It actually lowers our blood pressure when we're asleep. If we're not getting enough sleep, it impacts our memory. It can actually lead to an increased development of beta amyloid, which is significant in Alzheimer's disease. It could impact men by reducing their testosterone. It could lower our immune system. So many things could happen. And of course, increasing our injury rate because we're so tired. People falling asleep at the wheel. We need to get enough sleep. So that's 6 to 8 hours at night, at least, that we need. Because as I said, it has a multi-directional effect on other things that we do. If we don't feel rested, we don't want to do other things. We don't want to exercise. If we don't feel rested, we may feel like we have to eat more to get the energy we need. There's so many problems when we're not getting sleep. You get headaches if you don't get enough sleep. So we need both deep sleep and rapid eye movement sleep, where the learning and cognition and all those things are repaired during that time. So how to optimize your sleep is here on this slide, just some tips of what you can do. You need a dark, cool environment. Make sure you're not eating within 30 minutes to an hour before bed. Cut the screens. Don't exercise within 2 hours before going to bed. Maybe you need a mineral supplementation like magnesium to help relax your muscles. Maybe determining a sleep position for you would be better. You need to really try to sleep on your side. Uh, some people use the Breathe Right strips and chin straps that help some folks. And then this 4-8 belly breathing. I looked it up. You can look it up on YouTube or something, or somewhere on Google, but you can find out how to do this breathing practice. And for some people, it does help to relax them. So, moving on to stress and stress management, and why is this important? Because we're all stressed in some way at some point or another, but it can cause harm to our health if we're chronically stressed and make you less productive, leads to anxiety, depression, obesity, heart disease. It really can cause a number of problems if we do not learn how to manage this well. And so, more than 3/4 of US adults are reporting or experiencing symptoms of stress, which could be headaches, tiredness, depression. And in 2024, 43% of adults reported feeling more anxious than the previous year. And then there was a study done on work related stress in 2022 where 83% of US workers reported experiencing work related stress. And about 31% of employed adults cited difficulty managing work and family responsibilities, while 35% noted that their job interfered with personal time as a significant stressor. So a lot of us have to work, we just can't get out of it. And work may not be the only cause of the stress, but it can be multiple things that's causing stress. But we have to, as I mentioned, find a way. And I'm going to give some tips on how to do that in the next slide, but we've got to get a hold of this because it does lead to other problems, whether it be depression, obesity, or heart disease, as you can see here. So these are some of the suggestions that I have on how to manage stress here that I want to quickly give you. Some people like mindfulness and meditation. That may help for you. Breathing awareness and doing yoga type activities, which also could be an exercise, but it's more so for mindfulness and meditation. Maybe walking, doing aerobic exercises and dance. And this is because exercise actually does increase your endorphins, your happy hormones. And so it can help with combating stress. Some people need to do cognitive behavioral therapy, and this is identifying and modification of negative thought patterns. Depending on what you're going through and what you're dealing with, that may be more helpful for you. Sometimes it's just, again, the diet as an underlying factor. If you're not eating right, consistently not eating right, it's going to start having impacts on different parts of your body. You may have foggy brain, which could lead to you're not doing your work right or even schoolwork, and it could cause stress. So we need to make sure that we have a balanced diet. Looking at sleep hygiene, as I mentioned, we need to have regular sleep patterns and create a restful environment to, and again, minimize screen time before bed. With time management, we need to learn how to do a little bit better job at that. If we're stressed out, prioritizing, what's more important and setting boundaries and just say no. If you're having an issue with time management and it's causing you to be stressed, sometimes just saying no is helpful. Looking at relaxation techniques, again, this could really go back to yoga or mindfulness and meditation, but it does help some people to relax their muscles, doing deep breathing exercises or visualizations. Social support networks, depending on what you do in your community. You have a church family? Do you have good relationships within your immediate family? These people can help you through stressful times, and especially depending on what's causing the stress. Just look for and lean on people. Don't do it alone. Have people help you. And then, of course, spirituality, because for me, that's really the biggest stress reliever for myself, engaging in spiritual practices. I read my Bible, studies actually showed that 60% of US adults back in 2024 did find comfort in spirituality during anxious times. And so that enhances your overall well being alongside other things that you may do to help reduce your stress. So, next, we're going to talk about addictive substances. It's several different types. There's depressants like alcohol, stimulants like crack cocaine, and nicotine and caffeine, if you overdo it with caffeine and nicotine. There's opioids like pain medication. And then there's hallucinogens like the marijuana, LSD. There's all kind of things that people are addicted to, and some people are secretly addicted to it, and you just don't know. But Americans are suffering in this way as well. More than 40 million Americans and another 80 million worldwide actually meet the clinical criteria for addiction or misuse of nicotine, alcohol, or other drugs. And so the presence of addiction or misuse doubles the risk of chronic diseases like arthritis, chronic pain, hypertension, heart disease, stroke, diabetes, and asthma. So, these things all go together. They all affect another aspect of health. And so we need to deal with our stuff because a lot of times when people are using addictive substances, sometimes they're masking the pain they're feeling, the stress they're going through. Sometimes, you know, it's just a part of their habit because it's a social thing to do and then it becomes addictive, alcohol, social events, and then there's no self-control. So with managing this, we need to first look at lifestyle changes. Again, back to the basics: regular exercise, healthy eating. Are you getting enough sleep to support that recovery? Then some people may need support groups. There are many support groups available, some for free, that you can go to and get help, like Alcoholics Anonymous or Narcotics Anonymous. Some folks may need counseling, individual or group, but sometimes, again, it's addressing the underlying issue on why you are using the substance in the first place. Mindfulness and relaxation techniques that we mentioned, like the yoga, the deep breathing, if that works for you, then that's what you need to do. And then there's some people who will need medication assistant treatment. And this is using medication. Some people are using methadone or naltrexone. This will help reduce cravings and withdrawal symptoms to help you become sober. And now we're going to talk about social connection. This is the last pillar of lifestyle medicine that I will go on. We're going to lose time in just a moment so that we got a couple of slides left. People that have poor social connections are at 50% more likely to die from cardiovascular disease compared to those with strong social ties. And so you all may be familiar with the Surgeon General who reported that social isolation and loneliness was a pressing public health issue. Well, again, these unhealthy relationships also can increase death and disease. So make sure that you find your people, find your group. You never know until you put yourself out there. Just isolating yourself is not healthy because loneliness can actually increase the risk of premature death up to 26%. So you want to find your people and connect with them so that you can live a stronger life. So overall, just to recap, again, this is another study just looking at relationships over 10-year period. And they basically concluded that these different aspects of lifestyle medicine, a low-fat diet, these people were studied. Some of them did aerobic exercise on a regular basis. They didn't smoke. They had adequate sleep, and it was associated consistently with preventing chronic diseases. So, lifestyle interventions have powerful healing properties at any stage of disease. And there are over 57,000 research articles that address lifestyle medicine approach. So I encourage you to look them up. I'm actually going to provide some references. So I put a couple of SMART goals here, just so that you can think about it from a more tangible aspect. You don't have to do everything and be perfect at once. Just setting small goals and realizing how ready you are is important. Maybe you'll say, I'll go for a 30-minute walk after work. Maybe I'll do that 2 days a week. Maybe today I'll start limiting my soda intake to 2 cans per week. Hey, maybe I'll start implementing meatless Mondays, or let me start taking a 1 to 2 hour nap on a particular day, or maybe swap your French fries for baked sweet potatoes. Anything you can do or think of to make small changes are going to make a big impact over time. So I want to share, as I mentioned, our clinic, our organization, Community Whole Health, we do health education workshops. We have one coming up on April 12th, and this is going to be about preventing, managing, or reversing diabetes. Our facilitator is a certified diabetes educator and a registered dietitian, and we're going to be giving out some raffle prizes. We have one $100 Publix gift card, and I know another raffle prize is a Beat the Bomb gift certificate. And so we'll be having complimentary refreshments, but we invite you to join us at the Stonecrest Library Auditorium. You can register on our website or use the QR code here. And I also encourage you to follow us on social media to keep up to date with what we're doing. We're on Instagram and Facebook. And we're growing. As I mentioned, we're going to be opening up our new clinic this August for people who do not have insurance or are underinsured. And our model is lifestyle medicine. We will prescribe medication when necessary, of course, and other measures. But we're really focusing on prevention of disease, reversal of disease. We want to make people well. And we're going to be located on Emory's campus of the Emory Lithonia Hospital, Hillendale Hospital. So this is the references to what I talked about today. You can scan the QR code, and there's lots of studies that I got this information from. You can have access to that and other websites about lifestyle medicine. So I thank you for allowing me to present to you today. Here's my contact information on the screen, and I do invite you to visit our website at cwhclinic.org for more information.
Great, thank you, Ms. Kashmir. I do have a couple questions. Let's see.
All right.
So in your personal study, what is the percentage of, as far as the health, when people transfer to or transition to either plant-based, vegetarian, or pescatarian lifestyle, are they like percentage-wise healthier in a more plant-based diet, healthier in a vegetarian diet, pescatarian diet?
I don't have an exact percentage of that, but I'll just say that a lot of times people cannot stick with these specific diets. Pescatarian, vegetarian is harder for some people. And so I've actually seen a lot of folks revert back to doing what they did because they felt it was too restrictive. So I've never done a study per se, but I will say I've seen over time more people just stick with small changes, honestly, in eliminating the hazardous things. Like some people will just stop eating sugar. Some people will eat plant-based. And I know Dr. Rook, I don't know if any of you ever heard of her out of Morehouse. She also has a like a plant-based clinic. Now she has testified, because she's been practicing way longer than me. She has testified to healing, because she's seen from beginning to end, patients that have stuck with her through many, many years. She has seen healing from plant-based diets more than any other diet.
Gotcha. I can personally attest to that. I'm a vegan myself. So, so it does
Yep.
do a lot of the healing. Would you, as a doctor, which diet would you prescribe best? Would you prescribe best though for people, or is it based on a certain health?
I do think it is based on what you're dealing with, but I would just say the Mediterranean diet, because it's low sodium. It emphasizes fruits and vegetables. I would say Mediterranean, but I didn't have time to go over the blue zones today, but I encourage you to look it up. What people in the blue zones eat is what I would recommend eating, because overall it's a plant-based diet, and plant-based doesn't mean you're excluding anything. This just means you're focusing on eating more plant things that grow out of the ground more than anything else, because this is not to teach to get rid of things. It's more to say you should not be consuming too much of this. It's really teaching self-control, to be honest. So I would say, if you had to name a diet, I would always name Mediterranean, because it's a balanced diet. It's the essence of the plant-based diet without calling it a name. But because if you need something to call it, that's what I would say. But really, if you look at the blue zones, those are areas of the earth where people live the longest. And there's a place in Japan, there's a place in Linda Loma, California. They're eating plant-based foods. They're eating nuts and seeds. Um, you know, they say carbs are bad, but you need carbohydrates. You just need the right kind of carbohydrates. So I'm not saying exclude something unless that's what you want to do on, you know, for your personal preference. It's just finding time to really cook your own food and make sure that most of it is plant-based and not packaged or processed.
And another question. So, what are your viewpoints when it comes to Dr. Sebi? I know it's kind of like a correlation, but I know people they follow his rhetoric and some don't. They believe it's way too strict. Would you prefer or recommend some of his dietary
I would
recommendations?
recommend, and I'm be honest, I'm so passionate about this for several reasons. 2 years ago, I was told I had diabetes, and I was thin as a, even thinner then. I was as thin as a rail. Um, and I was diagnosed with this, and I was just thinking, what in the world? I didn't know if it was a fluke or what. I went and I read one of his books about, you know, clogging the pancreas, and I actually followed a lot of his teachings about how to unclog your pancreas, but it makes perfect sense based on what I just taught, even though I did not go into details. You know, actually, the main reason why people are getting diabetes, sugar, yes, is a huge contributor, but the real reason is because you are clogging your pancreas because you're eating processed fatty foods like bacon and meats that actually cause your pancreas to be clogged. And so I started following some of those teachings, and I mean, I've never had an issue ever since then. Actually, my doctor now says we made a mistake. You know, they refuse to acknowledge that what I did actually maybe just completely reversed it, because at the time I had a really bad habit of drinking Diet Coke, which clearly I read a study and it was like a light bulb went off. This study clearly says that this has, you know, impact on your pancreas and how your insulin is processed, and it's just bad for you. It causes cancer too. So I would just say, as far as Dr. Sebi goes, I would I would look into each individual thing. I wouldn't just say, I'm going to follow anything or any person outright without really learning what it is that they're teaching and learning why they're teaching it versus just saying, okay, I'm just going to follow him. Because I don't know everything he teaches, to be honest. I just know I came across his book, thank God, about diabetes and clogging your pancreas. And that was what I needed at the time. And that's what I studied. And I have heard many things that he teaches, and as I read it and through my experience and through the research I've read, it is on point. But I can't just say, because I haven't read everything. So I don't want to just say, yeah, follow it. Because if I ever come across something that is not, you know, congruent with the science, then, you know, I may have an issue. But I have learned so much from him. And I do recommend, you know, at least a study on diabetes. And if there's anything else out there, I'd be happy to further investigate. But I just I just know it transformed me personally when it came to diabetes.
And then as far as vegetables, I know a lot of them, such as kale, the dark leafy greens, they're really good as far as not only protein, but iron and things like that. Would you suggest those kind of things for anyone that's maybe having issues with their iron, or would you push more of those dark leafy greens for them?
Yeah. So can you repeat the question again? 'Cause I missed the first part.
Oh, sorry.
It's
So
okay.
as
No.
far I'll just say it like this. So with anyone that has maybe health issues with their iron or things like that, or anything with blood related, would you suggest them or refer them, or I'll use the word recommend them more towards dark leafy greens, or would you prefer certain meats or certain kind of fishes to them to help them with that?
Yes, yes, definitely with the dark leafy greens. And yes, you do get iron, you know, from you do get it from beef, but it depends on what their situation is. I'll say that first, because I don't like to just say go eat this, because I don't know all the nuances of what you're dealing with in your health. But essentially, yeah, iron is in dark leafy greens, and I would certainly recommend that anyway, because we're not getting enough of that. And you do get iron from that, and you can actually, um, like I said, get it from some meats, but I would just be careful not to make it a habit to eat a bunch of meat all the time. But at the same time, it's okay to eat meat, lean meat. It's just it's in the overdoing it, I would say. You have to be careful when you overdo anything, really.
Okay, gotcha. So would it make sense to practically cut out the middleman? Would you consider meat being the middleman that we can just get our vegetables or plant-based straight from the ground rather than having it processed through another body and then consuming it?
So that's a great question. So we can live without it. Yes, we can live
Oh,
without meat. You can live without it, but meat was never, it was always a delicacy, right? Even if you go way back into old ancient times, we're supposed to be eating a hand or palm full rather of meat a day. That's actually, we're eating way more than that. And a lot of times it's cooked, is fried or something. Is we have to be very careful when I do cook beef. Every now and then I do actually make meatloaf. I make sure that I get grass-fed organic beef, and that's rare, but I do cook it because there are some benefits. But cutting out the middleman, that's totally fine. If you can live without it, you don't need it. To be honest, you don't. If you're gonna eat the right amounts of foods from the ground and you're okay with that, you don't feel like you're missing out on life, it's okay. Meat is a delicacy, just like all the other desserts are.
sure. All right. Let's see. I don't show any more questions. Is there anything else that you would like to go over one more time?
No, but I'd like to just re-emphasize looking into the blue zones. I wish I would have had time to really go over that, but it was a powerful study. There's lots of books on it, but it's just interesting to know that there are certain parts of the world where people are indeed living over 100, over 120 years, and they are functioning well. And a lot of things that they're doing are what we talked about today, the pillars of lifestyle medicine. They have good connections. They cook together. Cooking is something they do with family. They do things for enjoyment. They use herbs and spices. I didn't get a chance to talk about that today, but garlic, onions, these different things have powerful healing properties as well, and they bring flavor to your food. So if you study people in the blue zones, they're doing a lot of these things. They're getting exercise because they're always outside. They're getting sun. Their vitamin D, are at the levels where they're supposed to be. There's a lot we can learn from people who live in the blue zones. It's a way to thrive because you don't want to just get by. I don't, at least. I want to live a stronger, longer life, and that's the passion that we have in our clinic and in our organization, is teaching people, especially the disparities we see in the minority community. And it correlates honestly with people with lower income, lower education. You don't know. And then you go to the doctor and you don't realize you're actually in charge. Your doctor, they work for you essentially, right? You're paying them in some way. And so you should be going somewhere where people are taking the time to listen to you. What you think about your body matters because it's your body. Your doctor's listening to you for what, 20, 30 minutes. There's some excellent providers out there, but there's some people who are overwhelmed. So you have to realize it's your responsibility. I've encountered patients, and I see patients all the time that don't even know what medications they're taking. And it annoys me really, because that's something you should know. You should know what you're taking, what the side effects are. Why are you taking it? It's your responsibility. It's your body. And it's like I'm always telling people, do you want to live longer? Do you have a purpose? The answer should be yes, you do have a purpose. So what kind of life do you want to live? A lot of people stymie their growth in whatever they're doing because they're cut short due to disease. Their life is cut short, and I just don't believe in that. So you know our mission is to educate as many people as we can and to help as many people as we can. When we open this clinic, we are going to be volunteer based, and I'm going to be working in the clinic along with some other experienced physicians and physician assistants. And our goal is to make people healthy. So I just encourage you to learn about what we're doing and really just get on board and support us, because we want to make a difference. This is not for anything else. We're all volunteering. No, I'm volunteering as well. This is because I have a deep passion and I'm tired of seeing what's going on in this country that can be changed by something that's actually right at our fingertips. We don't need a whole lot of money to make these changes.
All right. I want to say thank you, Ms. Cashmere, for joining us today. In
Thank you.
closing, and on behalf of our director, Mr. Damon Scott, and our new CEO, Ms. Lorraine Cochran-Johnson, we want to say thank you to our wonderful speaker and our amazing audience. We are happy that you took the time out of your schedules to be with us today. Please continue to look out for our future Lunch and Learn webinars. May everyone have a great day. Thank you,
Thank
Ms.
you.
Cashmere. Bye.
No problem. You all have a wonderful day. Bye-bye.
You as well. Bye.